You're listening to the Beyond Nurse Residency podcast, an educational series where we interview experts on all topics related to the transition of new graduate nurses into practice and beyond. I'm your host, Nicole Weathers, director of the Iowa Online Nurse Residency Program. Thanks for joining us. Let's jump in. Nurse well-being is a topic we've been deeply committed to in our nurse residency program over the last several years. As many of our listeners know, we've been intentional about educating our nurse residents on the importance of well-being, not just as a response to stress, but as a proactive skill set. We focus on building interpersonal skills like optimism, emotional regulation, and self-awareness to help nurses navigate the demands of the profession before stress leads to overwhelm or burnout. As we continue to face workforce shortages, increasing complexity in care, and emotional fatigue, the well-being of our nurses, especially those just entering the field, has never been more important. The transition from student to practicing nurse is a time of incredible growth, but also vulnerability. And if we don't support our new nurses well, we risk losing them before they've had a chance to truly thrive. In today's episode, we'll explore the challenges new graduate nurses face when entering the profession, the role of the organizational culture, and what we can do both practically and systemically to create environments where well-being is not just supported, but it's prioritized. My goal is for you to walk away with practical strategies you can use to strengthen nurse well-being in your own organization. And today, I'm truly honored to be joined by Dr. Cory Church, a nationally recognized expert in nurse residency programs, transition to practice, and nurse well-being. So welcome, Cory. Thanks for joining me today.
Hey, thank you so much, Dr. Weathers. It's good to be here. Congratulations on earning your doctorate. That's a big deal.
Thank you.
No small feat.
It is
Yeah.
no small feat. And this is a timely conversation because as we're talking about, stress and burnout, it's kind of like as you come to the end of a big goal like that, some of these things kind of start to show up. So um, I'm just really excited to kind of dive into today's conversation. But before we do, why don't you start off by telling our listeners a little bit more about yourself?
Yeah. Well, again, thank you for having me. I've come to realize in all of my work that we always have transitions in life. So anything that's applicable to new nurses can be applicable to any nurse, any person. But again, my name's Cory Church. I'm an associate professor in the School of Nursing at Texas Tech University Health Sciences Center. And I have been studying new nurse well-being and retention and workforce development over the last 8 years since earning my PhD. My dissertation was on looking at organizational commitment in nurse residents. And nurse residencies at the time were just getting off the ground. And we have done an incredible amount of work since then in the transition to practice arena. I've published in several articles on new nurse workforce, particularly this year we published on the newly licensed registered nurse population. We looked at the national sample survey. So we're going to hopefully get to talk about that. And I also just recently finished up a well-being study. So just happy to be here. Thank you so much.
Awesome. Well, I'm excited to hear as much as you can tell us about some of those studies and articles that you mentioned. So let's kind of begin by setting the stage a little bit. So the transition into practice, of course, we know can be overwhelming emotionally, physically, professionally. From your perspective, what are some of the most pressing challenges new nurses face in maintaining their well-being during this critical time?
I think most of us know that our profession can be emotionally intense, physically demanding. The physical work of being a nurse is hard. And some new nurses are going to enter practice settings that may be under-resourced or understaffed. And what we are seeing in our recent research is that 54% of new nurses are at an increased or severe risk of distress. That's a big problem. It's really staggering numbers. And in our look at the national sample survey that's coming out in Nursing Outlook this month, 91% of new nurses have reported burnout. And that's all just since the pandemic. This research has been ongoing for many years, dating back to the 70s. Nursing is not easy to work in, but the challenges that we're facing are different than they were before the pandemic. We're also looking at a workforce that is primarily Gen Z. And if you look at workforce demographics of Gen Z, they're in a position where they're financially strapped. They're often overwhelmed or depleted. They are aware that they have some mental health challenges, but they are not necessarily prepared to enter a system that may or may not prioritize their individual well-being, or the system has not developed to prioritize the well-being of our workforce. They are already, what we're seeing in academia is that our new nurses or our new nursing students are already coming to us that way. And we're having to build cultures of resilience and well-being while they're in nursing school. And they are going on to become nurses in a system, again, as we said, that may or may not prioritize that. A lot of our Gen Z nurses are living paycheck to paycheck. You can look at our national sample survey research that shows that a majority of new nurses are taking out loans to be in nursing school. And we're also seeing a housing and food crisis in students. So as they're coming into nursing school, we're seeing this, and then we're placing them in an environment where they may or may not be prepared to handle that. So this is not just necessarily a nursing practice thing. That may also be a demographic that we're working with. And that's a little bit different than what we have dealt with in the past.
So I want to just pause 1 second right there, because two things that you said really stood out to me and kind of reminded me of some other conversations that we've had on the podcast. So first is this idea of, are the students ready to enter this practice setting, but also are our practice settings ready for the students? And so when we talk about like new grad preparedness and readiness for practice, like we fail sometimes to talk about organizational readiness, and are we ready to bring these new nurses into our organization? Are we prepared to meet them where they're at, to help them kind of overcome some of these challenges? And so I really just like that
Yeah.
you bring some attention to that, because I think that's something that we don't talk about enough. And
Mm.
when we talk about sort of this in between practice and academia, and are you sending, practice ready nurses, the fingers usually pointing back at academia and not necessarily at, but are you getting prepared? Because this is what we're sending you. So I think that's just an important conversation. And then this idea of, you're talking a lot about, personal finances, housing, food. We spoke with Dr. Rose Sherman on a previous episode of the
Yeah.
podcast, and she kind of brought up this idea of, I'm trying to think of what she called it. So, social determinants of work health, I think, is kind of how she phrased it. So these are things that aren't necessarily like work's responsibility or something that work can directly impact, but because of these things, because of these social determinants of work health, it has impact at the workplace. And so maybe we
Yeah.
need to start thinking about, again, what we can do to kind of support um,
Oh, absolutely.
those pieces.
And the thing about academia, I would say, is there's only so much we can control and do within the time frame that we've been given to educate nurses. If I had a magic wand and everything was great, I would probably make nursing school longer and residencies longer. What we're seeing is nursing practice doesn't look like it did even 20 years ago, 10 years ago. And we're still expected to prepare nurses to fully practice, be fully practice ready in an environment that doesn't look anything like it used to. And nurses are being expected to do more with less oftentimes. And yet I hear about these academic practice partnerships where they're saying, we're we're speeding up the transition to practice. We're getting people in there. We're getting them ready. Our nursing programs are getting shorter and shorter. I don't know that that's necessarily a good thing. Um, and then, a residency doesn't have to necessarily be 1 year. It could be 6 months. I don't know that's always the best thing. We get in nurses and we push them out, and yes, we have a shortage. But I think that nursing school could stand to be longer and allow us time to actually embed nurses more into our clinical practice environment before sending them out to be work ready. But that's a great point that Dr. Sherman makes. I've never heard of that term before, but it fits perfectly because your new nurses are going to bring all of that with them to work. They're going to take it throughout their day. They're going to reflect on it during the day. It's something that's constantly in the back of their mind. So that's a great point.
So,
Great
do you
point.
think these are things that didn't exist for prior generations of nurses, or is it just generationally how these things are sort of looked at or um, talked about is just different?
So I think we have seen some of it in earlier generations, but we are seeing a generation that's being impacted by world events and by financial stressors, and that hasn't gotten better. It's just gotten worse. On top of that, going to school, nursing school, may be a challenge for some. It definitely, the idea of you're earning a degree that costs less is not, it's not there. Um, so you were seeing some of these things even for like millennials like me, but it's just gotten worse. A lot of Gen Z nurses are looking to pay for things on their own. They're having to because their parents are not necessarily able to provide that for them. There's just a lot of different factors. I think it's just gotten worse over the generations.
Hmm. And kind of this point that you made about quality over quantity, or like quickness, I guess. I mean, I'm a firm believer of quality over like how fast we can maybe get some things through. I think there's obviously a fine line there, but I tend to agree. I get a lot of questions about actually just yesterday, there was a question about, do you see any organizations that are kind of like speeding this up from a year to like 6 months or 9 months so that we can get through it a little bit quicker? And I tend to respond like, I don't think that that's probably the best thing to do, especially when you look at the theory around transition and when reality shock hits and all of those things. It just doesn't make sense to have that support end at that very specific time when they are probably at their lowest through their transition. And so I just, again, like that you emphasized that
Yeah.
and what you shared.
Well, here's the thing, Nicole, is you look at any of our other healthcare partners, you look at OTs, PTs, physicians, um, and pharmacists. They're not expected to rapidly enter practice and go through nursing, their program in a short period of time. And, you speak to other therapists and providers, and they have an extent amount of clinical hours before they are released on their own. A lot. And yes, nurses are serving on the front line. Yes, we have a responsibility to get them in and get them working. But you look around at our interprofessional team, they're not expected to do the same thing. So why is nursing? It just
It's a great
it's
question.
always puzzled me. So yeah,
Mhm, mhm. Well, and it is a great question, and you see all these accelerated programs popping up, and we just have to churn out more and more nurses, but few people are talking about why do we need to keep churning out more nurses? Like, what's happening in the practice setting? What are some of those holes that we need to start plugging? And I think our topic today is probably
yeah,
one of those things,
absolutely.
right? Is how our organization sort of preparing to support the well-being of the nurses as they come in. So we know that individual resilience, is often talked about, right? We need to build more resilience in these new nurses, but we know that that can only go so far without the right environment. So why don't we talk a little bit now about sort of that organizational impact? How does organizational culture like leadership, staffing, psychological safety, how does that all impact the well-being of these early career nurses?
I will add that a lot of the research on well-being in new nurses is outdated. That's what prompted me to get back at just identifying where we are in terms of well-being with new nurses. But a lot of the early research just centered around new nurses found that leadership styles are a great contributor to well-being in new nurses. Heather Laschinger was a Canadian researcher that did a lot of work around new nurses and their well-being. She found that authentic leadership was a significant predictor of well-being, meaning that you're showing your new nurses that it's okay to make mistakes. You're providing a safe place for them to speak about their mistakes and their well-being. You're showing them the humaneness of being a leader. So absolutely, leadership has a lot to do with it. And if you look at our national sample survey research that comes out in Nursing Outlook, what you'll find is that leadership styles or leadership and management behaviors is a top reason why new nurses leave. So that tells you that it's certainly important. In terms of staffing, I tend to say that staffing is not always in the control of a nurse resident or a nurse residency program. Obviously, it's a priority, should be a priority for your organization, but there's just certain things out of our control when it comes to helping new nurses. I like the fact that new nurses, you know, are only taking care of a certain number of patients and they're growing that as they get more practice and gain more confidence. So certainly scaffolding the number of patients they receive. Staffing may or may not be within our control. It is a top reason why new nurses decide to leave. So it should be a strategic priority. But one thing that organizations should be leaning heavily on is making well-being a strategic priority. I don't know if you were able to sit in on some of the sessions at the Transition to Practice Symposium, but there was one organization that they showed their organizational strategic plan. And right there beside financial stewardship, they had well-being. That says to me, your organization is prioritizing that. You're making it an important factor. You are maybe even monitoring it or collecting data on it, just like you would do any other quality data. So that's certainly a system level priority that should be there. So yeah, all of those things are important. What we know over time is that there's not just one single magic pill for well-being in the nurses. It takes a comprehensive approach. Um, Mindfulness practices and resilience building in nurse residency program, check. You got to have that. That's just one important component. Having opportunities for them to connect with each other, with their peers, certainly a priority. And then again, well-being being a strategic priority and investing in that peer support.
In that presentation that you were talking about, did they give any examples of what their kind of strategic actions looked like to support that idea of well-being?
Certainly they're monitoring well-being. I didn't necessarily catch what they're doing at a strategic level, like an organizational level. But a lot of what I saw from nurse residency programs or fellowship programs at these presentations was they're doing daily check-ins. They're checking in on the well-being of their new nurses and their fellows consistently. They're offering well-being huddles where it's an opportunity, psychologically safe environment for them to talk about their feelings, their emotions, their struggles in practice. And they gave some of the examples from their residents and fellows, and it was like, the opportunity to share my experience with other people and hear that I'm not the only one experiencing this was fulfilling to me. Those are all good strategies.
Yeah, and I would say that is something that when we talk to our residents a lot in the program, that is something that comes up over and over again. It's just this chance to hear from others and know that it's not just me. I'm not the only one that you know, at 6 months felt like I wasn't cut out for this and I wasn't sure that I wanted to be here, or, I'm not the only one that has, that difficult coworker, or I'm not the only one that has whatever it is. Just knowing that you're not the anomaly of being the only one to have some sort of experience just gives you a little bit more peace, I think, peace of mind, that it's normal. There's nothing wrong with me. There's nothing wrong with my unit or my organization, and that this is just what it's like, what the experience is like.
Yeah, and normalizing that, offering a safe space for people to talk about it. We hear the term psychological safety. absolutely has to be there in a residency program, but offering that space where even if your nursing professional development practitioners don't necessarily have the time or the space to do that, maybe offering a counselor or a therapist or just someone who can navigate a peer support group and allowing them the opportunity to, speak up and share.
And I like that you bring up it doesn't always have to be the NPD, right? Or it
Right.
doesn't have to be the person running the residency programs. What other resources do you have available? What other people, players,
Yeah.
do you have on your team that maybe you could pull in? It doesn't always have to be kind of that same person.
Absolutely. And it's not just about speaking at your residents about these things. It's not sitting them down in a chair and just speaking at them and saying, yeah, you need to be healthy and you need to work out, but actually living it out, showing them that it's real action. That's the one thing about Gen Z is, and I speak to Gen Z because they're the primary demographic here, but and it's just for context. But they wanna see real action. They wanna know that when you say that you care about their well-being, what are you doing about that? It's not just, you're not just speaking it, you're actually living it out.
Yeah. So, we have a kind of a different approach to nurse residency where we have like a flipped classroom. So
Okay.
there's online content that they do before they come together for that discussion. And we had one organization in particular who, because of their policies, they were like, everything has to be done sort of on site within this time frame. So what they did to sort of accommodate that, and I think also sort of attributes to this, like showing them that I really do care about your well being, is they allowed them to, they just told them, bring your earbuds, bring your phones, and then just come on campus and, listen to the podcast for this month, but go for a walk. Right. And so they're not only, learning, but they're also kind of getting that opportunity to get paid to move their body a little
Yeah,
bit, which I thought was really a unique sort of approach to that.
absolutely. So, again, I just wanna reiterate, like, it doesn't have to be some fancy curriculum. Just offering a space for them to reconnect or, share with peers, but absolutely, you've gotta have some sort of well-being strategy in your residency program, not just sit down and we're going to talk about well-being today. It needs to be intentional. So, yes, there are things that your organization can do, but then there's things that you can do within your residency program to sort of help pad that a little bit, to help it to amplify their well-being. So that definitely has to be there.
And I think one of the big things that's been talked about a lot at the PTAP level anyway is that it also isn't kind of a one and done, right? We don't just talk about it, 1 month and then we don't mention well-being again throughout the rest of the year. So I think, that's another kind of thing is not just how do we add it in, because we used to do that. In our 1.0 curriculum, it was we talked about it kind of the first month and then we sort of moved on from it.
Yeah. Yeah.
And then when we did our curriculum redesign, it was really like, how can we pull this in each and every month? That it's, kind of this constant reminder that these are some of the things that we also need to be focusing on that are just as important as those professional skills.
Yeah, and I forgot to disclose to the audience that I serve on the commission on accreditation for practice transition programs at ANTC, and so we have a lot of influence when it comes to rewriting accreditation standards. But if you look at the current standards for ANTC, it states that these things have to be integrated throughout the program, and that was intentional. We had the same thought. Nicole is like, it's not just a one and done. Show us how it's integrated throughout, and well-being is one of those standards. So just making sure that it's there, that it's intentional.
Well, because it's
Yeah.
so easy to, mention it once and check the box and say, "We
Yeah,
did it." Um, it takes a lot more intentionality, I think, to think about how can this be integrated, throughout.
sure.
Okay, so anything else you wanna share about sort of, this idea of well-being kind of at the organizational level or when it comes to organizational culture?
Again, like I said, a lot of organizations are making well-being a strategic priority. And if your organization is not, I would say that you need to be advocating for that to be a component. And then that's what your nursing strategic plan is taken from. And I would say it certainly has to be a nursing strategic plan priority. One of the other interesting topics that I heard at the Transition to Practice Symposium was, I believe it was, yeah, it was Rush Copley. Shout out to Rush Copley. But they were talking about how they take their residents off-site and they provide opportunities for them to engage in wellness activities. It could be pickleball, it could be, something else. But again, they're very intentional about it, but they receive organizational support for that. I believe they were talking about um, how they are offered an opportunity to fund those from their organization. And so that that shows again that you're being intentional about it. You're creating the space for it.
And I could see where, I mean, if that isn't part of the organizational plan, it would be hard to kind of get the support for some of those things at more of the nursing level. So that's great. Okay, so let's move on to the topic of research. So you've done it sounds like you've done a lot of research in this space. So tell us about your recent work. What, interventions or strategies and maybe have you found that are showing promise to improve well-being among new nurses?
Yeah, so I started looking at the literature on well-being because it started to become an important topic. If you followed the National Academy of Medicine, they started in 2019 with an action collaborative that said, this is an issue. We need to focus on it. That was before the pandemic, ironically. And then after the pandemic, it became even more important. But when I started to look at the literature on well being of new nurses, what I found is that most of the studies were outdated. And then you have the studies about transitioning during COVID, but there was nothing after that. It was like we don't have a sense of the well being of our new nurses after. And with any research, you can't really build on something that you don't have proof of. So that was my first step. I needed to get an understanding of where we're at. So I was funded by the Association for Leadership Science in Nursing, and thanks to them for their support for this study. But what we looked at is we just wanted a baseline prevalence of well-being. So we took the Mayo Clinic Nurse Wellbeing Index, and we assessed well-being in a couple of hundred new nurses. We found that 54% of them are at increased or severe risk of distress. And what that means is there's a strong likelihood that they will fall into a state of depression, burnout, or even worse beyond that. We also found that well being was a significant predictor of negative safety practices. So the worse their well being was, the more likely they were to perform negative safety behaviors. And that's concerning because it's not just a well being issue, now it's a patient safety issue. We also found, not surprising, that well being was a predictor of job satisfaction and turnover intent. So now that we have that baseline prevalence level of well being in our new nurses, we can start turning to things that are interventional studies. So I haven't necessarily done an interventional study. There are some good ones out there. Marlene Sampson and Bernadette Melnick out of Ohio State University, they looked at an intervention program called Mind Body Strong. And this was specifically in nurse residents. And that was everything from talking about well-being to activity, physical activity and exercise. That was a very strong intervention. Mindfulness practices have shown to be good at building both resilience and lowering stress levels. And there's even a study that has looked at mindfulness apps and whether they work or not. So those are all things that work. We know that those work. Looking also at our national sample survey, again, we know that many nurses experience burnout. There's a high rate of turnover in new nurses. But one thing that's notable about looking at the national sample survey is you're not only just looking at why they leave, you're looking at why they stay. One of the reasons that they stay is they say that the experience they have at the site is important to them. So the more experience they feel like they have, the better. Whether they have a balanced schedule is important to them. And then this sense of community with their peers. And bam, that goes back to what we were talking about is investing in peer support, offering an opportunity to engage with your peers, sit around and talk about the well-being challenges you have, going off-site and participating in something where you can connect in a positive way with your peers. And then the other thing was just a good sense of liking the job. So those are the reasons why they stay. That's the research that I have for you to date. And I think the next important thing is figuring out both system level and residency program or transition to practice program level interventions that work. One thing to note about my recent study on well-being is it doesn't necessarily drill down into specific issues. So one of the things I'm looking at studying next is getting a more comprehensive measure and looking at, is it your social life? Is it workplace violence? Is it your safety culture at your workplace? Like really drilling down and saying, what are the different things that we need to focus on? So for now, that's what I've been doing, and that's the research I have.
Yeah, that's awesome. I mean, I think, first of all, your statistics here of, 54% are at risk of distress and 91% have reported burnout. Like, that's mind blowing to me. That's a lot. And then, well-being and sort of how they rated their well-being was a significant predictor of negative safety practices. So when I talk to organizations, like how do I get, leadership buy-in, organizational buy-in? I mean, I think that right there is huge to coming back to the patient, coming back to patient safety, the whole reason that we're here as nurses. And so if we want to improve the safety and the quality of care that we're providing at our organization, like this is one place where we could potentially focus and begin to move a lever. Again, it's not going to fix all of the problems. It's not going to be a magic bullet solution, but definitely something that we have evidence to suggest that those two are related.
Yeah. And that's the thing is we've got to speak up and say how residency and transition programs are we've got to prove their value. Unfortunately, we work in a setting where we may or may not always be valued for the work that we do. We have to speak up. We have to point to things and metrics and data points that speak to our executive leadership. And speaking to patient safety, I would think that that speaks volumes to people. We've got to be able to say, hey, by investing in a residency program, here's what we have. By not doing it, here's what we have. I think residency programs have to monitor. We have to monitor outcomes. Yes, patient outcomes are not always easy to monitor within a certain population, but this is all self-reported data. So yes, there are limitations to that. But one thing I note in my article, which I have submitted for publication and hopefully it will get accepted, but one thing I note in there is, measuring self-reported patient errors and patient safety outcomes is one way that we can ensure that whether we're hitting a certain level that we need to be concerned about well-being. It starts with monitoring it and then doing something about it.
So I'm just thinking, like, as you're talking about this, so we have used the National Council, State Boards of Nursing, patient
Yep,
safety indices.
that's the one that I use.
Yeah, so we've sort
Yes.
of integrated this into our Casey Fink survey. So along with all the Casey Fink questions, they get these questions about positive and negative safety practices. And we were just meeting actually earlier this week with some biostats consultants on kind of digging into our data a little bit more and what do we all want to look at. But I think with the revisions to the Casey Fink survey and including some questions there about more well-being related topics. And then what you've shared here as far as, what you've seen as it relates to positive and negative safety practices, that might be an interesting thing for us to look at as well.
If you look at Nancy Spector's article from 2015, she obviously used that. And we found similar results as her. Um, and of course, our study wasn't just focused on nurse residents. I didn't want to limit it to just nurse residents. I wanted to say any new nurse. So we're about half and half in terms of those that were in the study were in a residency program and those that were not. I think that also is something Remind me to come back to that point about the differences there. But we found similar results. And one of the things is positive safety practices are not always a predictor. They weren't a predictor in my study. And I think that shows that new nurses want to have positive safety practices. I mean, that's a given. We all want to take good care of our patients. And patient safety, patient errors are not always the responsibility of the individual nurse. They can be system-wide issues, right? So those two things were not necessarily predictors. But when well-being worsened, negative safety practices got worse. So I think that's the key indicator that we should be focusing on. But also we can focus on positive safety practices, like, that those are good things too. Going back to the difference between residency programs and non-residency programs, that's been the other point that we have to continue to hammer home is we have outcomes for residencies and we have outcomes for non-residencies. And when we can demonstrate the value in terms of patient safety or patient outcomes from residencies, we've got to hit that point higher. That's another area that I'd love to research. I have so many that I look at and think about every day, but is looking at the difference to say these are great investments for your organization.
Well, and that's something I think we've been talking a lot about too, is the fact that all of the things that we talk about, whether it's competency or safety or, well-being, yes, we talk about them in terms of new graduate nurses because that's our focus. But every nurse across the career continuum, no matter what level of experience or setting or whatever, they need these same things. And so that is something that I could totally see as maybe a more experienced nurse. And maybe not in that leadership, hasn't maybe crossed the creek into leadership, but there are those experienced nurses who aren't in some sort of, leadership development program or anything, and they're not in nurse residency. It's kind of like, what are we doing for those folks to bring some of these same things into practice?
Any of this is applicable to nurses, early career, late career, they're all applicable. Like I said earlier, we all have different transitions in our life. And I would argue that a transition theory is pretty similar to anyone going through any transition. There's going to be periods of ups and downs. And then in the end, it's going to level out. These are all priorities that can be taken for other nurses, not just new nurses.
Absolutely. So if you had the opportunity to completely redesign transition to practice with well-being sort of at the center, what would that look like?
Unlimited money, unlimited time. Something I spoke about earlier is extending the time of residency. You look around at our other healthcare professions partners, and they're offered that extended time. I know that's not ideal. I know that's not great, but that's what I would do, is I would extend it. One of the challenges we face with that is prefectors and preceptor time. So that's hard. I like the idea of having like a chief resident officer or, an attending nurse that it sort of like a medical residency model that oversees that. I like the idea of definitely scaffolding the number of patients that we have, and extending that scaffold out a little ways. You don't plop a physician resident directly into a surgery on day one and expect them to cut into somebody. So I like the idea of extending that scaffolding. I think we need to do a better job of matching residents or nursing students to an area of practice that fits them. I think a lot of new nurses get into practice and they realize maybe this is not the setting for me, or they want experience with it, but then they want to transition to something different. And so sort of matching them before they come into residency is a good thing. I think we could explore that. Another idea would be we are monitoring your stress biomarkers or your well-being levels. And when you hit a certain level, you get a well-being paid time off, no issues on the side of the organization. We just give it to you. Time to recover. Maybe you've had a stressful event at work. Maybe you are an emergency department resident and you've experienced a traumatic situation, you get a day off on us as a well-being day. No questions asked. Time to recover from that. I wish there was an opportunity or a way we could say, I always laugh because I log into to look at my paycheck sometimes at work, and I have several hundred hours of sick leave. And I'm like, this idea that I have to be sick to take time off. What if I just need a day to just improve my well-being?
Mhm.
So changing the mindset from sick leave to well-being leave. And if there was a way to tie it to, hey, you go do a workout, you go to a counseling session, we'll give you a day off. So just prioritizing those things, if I could have it my way.
I love that. I mean, I love the idea of flipping this sick time to well-being time. I mean, that would be amazing because I'm with you. Like, I have so many hours of sick time sort of built up that I never use because I'm not sick a lot, thankfully, right? Knock on wood. But that doesn't mean that again, you should have to wait until you're sick to take that time. And then this idea of, like, I'm envisioning aura rings for the whole nurse residency program where we're monitoring this and, actually tracking their physiological stress
Oh,
response.
that's a great idea.
Because I do have an aura ring,
Yeah.
and for the last year of this, DMP program, it just tells me that I'm stressed, right? So, haven't quite figured out what to do about the information that it's giving me, but, it's still useful information.
It really is. That's a great thing. We can use AI for a lot of things. What if you now have an AI mentor or an AI peer that you can express your difficulties with? Maybe we offer a space for residents to sit down and have a therapy conversation with ChatGPT. Virtual reality opportunities where you can reconnect. They're all just one thing, one time, but sustaining those. And I talked about it earlier is there are things that are in your control and out of your control when you're leading a transition program. Some of the things at the organizational level are out of your control, but taking the time to provide mindfulness or resilience strategies or peer support or peer therapy or whatever it may be, there has to be something there. You've got to be intentional about it. So, um, yeah, there's a lot we can do, Nicole.
Yeah, and one of our previous guests, Dr. Patrick Jess, who does a lot in the space of well-being and resiliency, talks about too, not only providing content or education around mindfulness and teaching them how, but then helping them find micro moments throughout their actual work day to implement these things. So, yeah, I can't take a 30-minute break to go meditate, but one of the things, and I know I've shared this before, that he's talked about is taking the long way home, meaning what's the long way back to the nurse's station to just take that extra minute to like let your brain settle a little bit before you have to jump into the next thing. And so I think that's something that we could all do better about is we know a lot, right? We know a lot about some of these different strategies, but what are we actually doing to support them throughout the workday so that they can have that impact on the well-being that we know that they can.
Absolutely. Yeah, those micro recoveries.
Yeah.
Yeah. Again, being intentional about doing daily check-ins with your residents, I think can head off a lot of issues. The one thing about our current workforce is they are not necessarily going to tell you whether or not they are feeling burned out or stressed or whatever, and they will silently leave you from work. So it's important to create, again, psychological safety, that it's okay to speak up about your well-being here. And then two, checking in with them constantly.
Awesome. So looking ahead, what trends, what challenges do you see sort of emerging around this topic?
I think we're just starting. Last year, the National Academy of Medicine published the National Plan for Health Workforce Well-being. Have you had a chance to read that?
No, I haven't. I mean, I've seen some of their work over the years, but not that one in particular.
I think what's important about that, Nicole, is it's now a national conversation. And I think we have to continue to hammer home that national plan. That national plan says we're going to shift the focus from this being an individual responsibility to system accountability. Self-care is not going to fix understaffing. It's not going to fix poor leadership. Holding leadership accountable. Now maybe well-being metrics are a part of your performance review as a leader, just like any other quality outcome. Being intentional about measuring well-being. And then again, making well-being a strategic priority. I would say to any of your listeners, go and just read that. Even reading the high-level overview. That is a great plan. And I think the National Academies have been very intentional about continuing this work. Again, it started in 2019. It has continued on. And now they have a plan. It's got to be implemented. We're doing a lot of small things in transition programs, and they're all just kind of spontaneous. Certainly the transition to practice symposium showed that people are being intentional, but that's because it's a part of our accreditation standards. But again, it's important that it's a national conversation now. So we have to just continue to do the work.
Well, Cory, we have talked about so many great things today. We've talked about the challenges that new nurses face, how the organization can kind of influence nurse well-being. You've shared your research, which I really appreciate, and we'll make sure any articles that you've referenced, even this national plan for clinician well-being, we'll link all of this in the show notes so that our listeners can check those out.
Yes, please do.
We've heard about some really innovative ideas. I'm still like thinking about this Aura Ring thing and like how that
Sure.
could maybe work. So I really appreciate all your insights, all your perspective on this topic. But before we go, I do have one more quick question, and I ask this of all of our guests who come on the show. But when it comes to nurse well-being and supporting nurse well-being, what's the one thing that you've seen organizations do that made a significant difference and something that you wish more organizations would just adopt?
The one thing that I have seen is creating a space for you to talk about your well-being. There's no agenda, no PowerPoints, just true connection. A place where you can talk, you can decompress, and you can feel heard. So it's not sitting down in a class. It's not looking at a PowerPoint and telling you what well-being resources we have. Just offering an opportunity to say, let's huddle up and let's talk about these things. Being intentional and creating that safe space. I wish more organizations were doing that intentionally. And I use the word intentional, meaning there's no questions asked. It doesn't get rescheduled. You don't cancel it for the week. It's there. It's a standing item, and it happens. And it happens consistently.
And that seems like a very doable
Yes.
change.
I think so. I think that's a great place to start. Let's just start there. Yeah, some organizations are going to be better resourced. They're going to have more money to do things. They're going to have the opportunity to go offsite and do things. But those organizations that don't always have that, you can create the space, something simple that you can do.
Great. I love that. Well, thank you so much, Cory, for your time today.
And
This has
thank
been a
you.
really great conversation. An important conversation. I think one that we need to continue to have.
Yeah, let's keep it up.
And I look forward to checking out some of these resources that you have shared.
Thank you. And I'll be sure to share with you when I get my well-being article published. So
perfect. Yes, and we can add that to the show notes at any time.
Okay. Nicole, it's been a pleasure to talk to you. You've got national influence as well, and I was honored to come on the podcast. Thank you.
Thanks. Wait, before you go, I want to make sure you know all about our suite of resources you can use to support your new graduate nurses. This includes our Academy, a coaching program designed for organizations as they prepare for the implementation and ongoing sustainability of a nurse residency program. Work one-on-one with residency program experts to make sure your organization is residency ready. Our Clinician Wellbeing course is an asynchronous online course that aims to enhance the well-being and resiliency of healthcare professionals, equipping them with the necessary psychological capital to navigate challenges inside and outside of work. Supporting Nurses is another asynchronous online course for preceptors, mentors, and coaches to learn the skills they need to support any new hire. Both of these offerings can be used as a standalone professional development opportunity or to augment any nurse residency program. And we can't forget about the program that started it all, the online nurse residency program. This includes a comprehensive curriculum designed to support new graduate nurses applying all the knowledge they learned in school to their practice. We focus on professional skills, personal well-being competencies, and new graduate nurses even get the opportunity to create real change in their own organization. Offered completely online and in a blended format, this program is highly adaptable to all clinical practice settings. You can learn more about all of these programs and more of what we offer using the links in the show notes below.